This skill will begin with the opening. Knock and identify your patient. Introduce yourself by name and title. Describe what you will be doing, and obtain permission. This is a mannequin skill. The evaluator will play the voice of the mannequin during the test. Close the curtain and wash your hands. When you return, explain to the patient what you will be doing. Place a barrier on the overbed table to provide a clean place to place your clean supplies. Gather your supplies. You will need 4 washcloths, a towel, and a privacy blanket. Be careful not to allow the clean linens to touch your uniform. Obtain a wash basin and soap from the bedside cabinet and a pair of gloves. You will need 2 chucks for this skill, a clean one to place while you are cleaning and one to place at the end of the skill. Remove the call light from the bed. Carefully unfold the privacy blanket over the patient's top sheet. Do not snap or shake the blanket. Instead, carefully spread the blanket out over the patient to provide privacy and keep the patient warm during this skill. Have the patient hold the blanket in place while pulling the sheet down under the blanket to the patient's knees, ensuring the blanket is covering the patient for warmth and privacy. Apply your gloves. Open a chucks and hold it with the plastic side facing away from you. Roll the chucks toward you, about 3/4 of the way down. Place the chucks on the mattress beside the patient. Assist the patient to scoot her body toward you so she is lying on her back near the edge of the bed. Adjust the blanket so the patient will be covered. Assist the patient to roll onto her side facing away from you. The patient should now be lying on her side in the center of the bed. You will need to hold the mannequin in place with one hand. Roll the soiled chucks tightly toward the patient's buttocks and tuck under the patient's hip. Unroll the clean chucks onto the mattress and tuck the rolled edge under the soiled chucks under the patient's hip. Smooth the chucks and make sure the edges are tucked firmly under the hip. Return the patient to her back. Move to the other side of the bed. Assist the patient to tilt up onto her side to remove the soiled chucks and smooth the clean chucks toward you. Assist the patient to return to her back. Place the soiled chucks in the trash receptacle. Ensure the patient is safely in the middle of the bed. Take the basin to the sink to fill with water. Use a paper towel to turn the water on. Check the water temperature with the inside of your wrist and fill the basin 1/4 of the way full. Turn the faucet off with a paper towel and discard that towel into the trash. Ask the patient to check the water temperature. Ensure that you are explaining what you will be doing before performing each step to help the patient feel more comfortable. Place all 4 washcloths into the basin to keep warm and adjust the overbed table within your reach. Roll the blanket above the patient's waist, ensuring that the gown is encased in the rolled blanket so it will not get wet. Open the towel so that it is folded in half and place over the patient's thighs to minimize the exposure of the patient. The only area that should be exposed is the area we are washing. Wring the first washcloth out thoroughly. Smooth the washcloth out and ensure that it is folded in fourths. Hold it in the palm of your hand with the folded corner at the heel and the free leaves at the top of your fingers. Place a spray of soap on each of the 4 corners and the back of the last leaf. Position the washcloth in your dominant hand. Your non-dominant hand will rest at the top of the patient's peri area, and you will use your fingers to spread the labia apart. Clean with one stroke straight down the middle, and then pull the washcloth away. Fold that leaf over. Using the second leaf, clean down one side of the labia from top to bottom and pull the washcloth away. Fold that leaf over. Repeat on the other side of the labia and fold the leaf over. The fourth corner will clean the skin fold between the leg and the groin. Then this is folded forward as well. The back side of the washcloth is used for the other skin fold. The washcloth is then discarded to the side. Grasp a clean washcloth and wring it out. Rinsing is done exactly the same as washing, except that we do not apply soap to the washcloth. Hold the washcloth in the palm of your hand with the leaves at the top of your fingers. Spread the labia apart and rinse with one stroke straight down. Rinse each side of the labia, folding the corners as you complete each stroke. Rinse each skin fold from the top to the bottom, using the front and back of the fourth corner. Set the washcloth aside. Using a corner of the towel over the patient's thighs, dry the peri area from top to bottom, making sure the skin folds between the leg and groin are thoroughly dry. Remove the towel and replace the privacy blanket over the patient, taking care not to touch the patient's gown with your soiled gloves. Assist the patient to scoot toward you and roll the patient onto her side with her back facing you. Ask the evaluator to hold the patient in place for you while you complete your cleaning. Wring out a washcloth and smooth it out, holding it in your dominant hand, making sure it is folded in fourths. Apply soap to all 4 leaves of the washcloth. Explain to the patient what you will be doing. Starting at the rectum, wipe upward toward the patient's waist. Fold the first corner over. Using the second and third leaves, wash each cheek of the buttocks from bottom to top and fold the corners over. Using the final leaf, wipe upward along the crease of the buttocks again. Set this washcloth to the side. Wring out the last washcloth and hold it in your dominant hand with the leaves pointed upward. Rinse the buttocks the same way you wash them, using 4 leaves. Up the center, one cheek, the other cheek, and up the center again, folding the corners over between strokes. Set this washcloth aside. Use the towel to dry all areas of the buttocks from the rectum toward the waist. Set the towel aside. Roll the soiled chucks toward the patient and tuck under the patient's hip. Open the clean chucks and roll it toward you, touching only the outside plastic lining, tucking it under the soiled chucks under the patient's hip. Assist the patient to roll onto her back. Adjust the privacy blanket for privacy. Move to the other side of the bed. Scoot the patient toward you and tilt the patient up to remove the soiled chucks and smooth out the clean chucks. Return the patient to her back in the center of the bed. Throw the soiled chucks away. Gather the soiled linens and place in the dirty linen hamper. Take the soiled basin to the sink and clean according to the basin cleaning procedures. Dump the water and rinse the basin. Turn the water off and set the basin down in the sink. Spray the basin with disinfectant spray. Use a paper towel to pick up the basin. Dry the inside with a clean paper towel and discard. Dry the outside with a clean paper towel and discard. And get a paper towel to open the drawer. Pick up the soap on the way to the drawer and place in the basin. Open the drawer with the paper towel and place the basin inside the drawer. Remove the barrier from the table and discard into the trash receptacle. Remove your gloves and throw them away. Explain that you will be removing the privacy blanket and restoring the sheet over the patient. Remove the privacy blanket by touching only the underside of the blanket, being careful not to expose the patient unnecessarily. Pull the sheet up over the patient as you remove the blanket. Adjust the linens for privacy, comfort, and appearance. Roll the blanket into a ball and place the blanket in the soiled linen hamper, being careful not to allow the soiled linens to touch your uniform. Ensure the patient has her call light and the patient's environment is neat and clean, and ask if she needs anything else. Open the curtain and wash your hands. Review the steps of your skill, make any necessary corrections, and tell the evaluator your skill is done. Need scrubs for your new career? Visit foryouruniforms.com and enter the code CNA Video for a special discount. Need additional resources? For Your CNA has what you need. With practice tests, an online workbook, instructional videos, practice kits and supplies, and our very own skills book with step-by-step instructions, you will feel confident when you take the CNA exam. Visit foryourcna.com today. Continuing education for CNAs are called in-services. In-services are now offered online at foryourcna.com.